Thank you for joining us. We're going to be talking about lifestyle medicine today. And this program is part of a new initiative that we recently launched. It's actually our second program in our series under our Proactive Brain Health Alliance that we're doing in partnership with C&D Life Sciences. This is a way for us to help people gain a deeper understanding of the causes of neurodegenerative diseases and ways that you might be able to pursue brain health and take action. So we're going to be giving you some education around those things, as well as actionable steps that you might take. As we know, technology is getting better all the time, and we are able to, thanks to advances in our tools and research, we're able to find out earlier for people who may be identified as being at risk for a future neurological condition. And so that kind of leaves us with the question of, okay, now what? What do we do? How do we maybe try to stay as healthy as we're aging as possible? So these programs are here to kind of address some of those things by giving you some evidence-based information, education, targeted action steps, and a supportive community. So that is part of the PMD Alliance Way. And of course, now with our Proactive Brain Health, you'll be able to find resources there. We do have a whole web page that we'll drop the link to. We're going to be offering monthly educational programs that address a specific topic related to general brain health, or for those who maybe have already been identified as being at risk, maybe preclinical or even in prodromal stages of a neurological condition. Today's program is going to be recorded, and you'll actually find the recording on the Proactive Brain Health Alliance website. The other thing that is part of this Proactive Brain Health Alliance is not only these programs monthly, but we will also be offering a quarterly program for those who have identified at risk, either due to genetics, family history, or environmental factors, or they're preclinical or they're prodromal, where you can ask some questions and gain some actionable steps. And our first program in that series is actually going to be coming up on October 29th, so stay tuned for that information. I want to introduce the two speakers that we have today that are actually experts in this lifestyle medicine topic. Firstly, we have Dr. Jill Farmer. She is a direct specialty care practice clinician. She is with Boro Neuro. She's a movement disorder specialist there, where she focuses on patient education and wellness, as well as the latest in medical treatments and surgical interventions for her patients. And then, of course, many of you might recognize this face and name. We have with us Dr. Rachel Dolhun. She is double board certified in neurology as well as lifestyle medicine. She's a physician fellowship trained in movement disorders, and she joined the Michael J. Fox Foundation back in 2014 to lead their medical communication. So I'm sure you have all seen her on their website and in the various videos that she's done. So I'm excited to welcome these two experts today. I'm going to pass this over to them. And I know we have some slides, and we, of course, will take your questions as we go along. Drop those in the chat. So I'm going to turn this over to you, Dr. Farmer and Dr. Dolhun.
Okay, let me share my screen, and then we'll get started. So hello, everyone. I'm Dr. Farmer, and we're hoping that this is incredibly conversational today, and we'll get a lot of information just from the questions that we've prepared to be asked, and also for the questions that hopefully you'll put in the chat. We have slides just to sort of highlight what we're talking about so that you have something to look at while we're speaking, but this isn't a slide-heavy presentation. All of this information is from the American College of Lifestyle Medicine. It is a website that both clinicians and patients can look to get information and resources, and hopefully you'll find it useful as you continue to work through and plan your Parkinson's strategy. And then Dr. Dolhun, I didn't know if you wanted to introduce yourself as well, just a quick hello, and then Anissa can kind of start feeding us some questions.
Great. Yes, thank you for the introduction, Anissa. Thank you, Dr. Farmer, for inviting me. Thank you, everybody, for being here. It's so nice. And in a lot of our webinars, we can't see faces. So it's really nice to be able to see who's here and to be here with you all. Like Dr. Farmer, I am a movement disorders neurologist, but through my 10 years at the foundation and through my regular conversations with people who are living with Parkinson's and their families, and especially during COVID, I really grew much more interested in lifestyle medicine. And we'll talk a lot about what that exactly is, but it's really the questions you all ask all the time. What's the best diet for Parkinson's or for brain health? What's the exercise I should be doing? And I grew tired of not having better answers and better tools to offer. So like Dr. Farmer, I got certified in lifestyle medicine a couple of years ago. And so I really now am focused on bringing lifestyle medicine more into the comprehensive care of Parkinson's. So this does not dismiss medications and surgeries and all those kinds of things, therapy that can be that are very beneficial for Parkinson's, but it's a complement and a way to amplify all of those tools that we have.
Awesome. Well, I think that you've kind of already mentioned some of the aspects of what lifestyle medicine is, but I would love it if you could kind of delve into and explain what really is lifestyle medicine and how do we apply that to managing chronic conditions, including neurodegenerative diseases.
So I'm happy to start.
Yep.
Lifestyle medicine is, I always say it's like the things our mom always told us to do when we were little, right? It's like go outside and get sunlight, play with others, eat your broccoli, get exercise, go to bed early, all of those kinds of things. So it's a lot of foundations and quote unquote basics, but it's really using our day-to-day and all of these things, how much we move, what we're eating, how well we're sleeping, how we manage stress, how we connect with others, whether we're avoiding substances that can be harmful to our bodies and our brains. And it's using these as the primary treatment modalities to manage disease like Parkinson's or other chronic diseases like diabetes or heart disease, but also to potentially prevent or delay the onset of some of these chronic diseases. And in some cases, like with diabetes, like with heart disease, even reverse those conditions. So again, it's really using these daily tools, all of these things that we have that we just need to learn how to better incorporate or how to optimize in our daily lives as tools to manage disease. In Parkinson's, we see a lot of benefit with easing symptoms, improving quality of life, potentially with some of them, even slowing the progression of disease. So these are really powerful tools. We just need to learn a little bit more about exactly what it means when we talk about nutrition and physical activity and all those kinds of things, and then learn ways to incorporate them. So I always say, everybody knows you're supposed to exercise, right? It's not about whether you know that you're supposed to exercise or you're supposed to eat well. It's about how do we actually do it when our lives aren't set up to have a lot of physical activity, when Parkinson's brings symptoms that get in the way of eating well or of connecting with others or sleeping well. How do we, as we live, as we evolve, how do we adapt and bring these tools into our lives to help us manage?
Exactly. And I will tell patients when I'm speaking to them, a lot of this is common sense, but that doesn't mean that it's easy. So the key about lifestyle medicine is it's entirely behavioral. So it complements the medications we use or the interventions we suggest or prescribe, but it is something that you have to do for yourself. And that can be incredibly daunting when you're dealing with the reality of having a chronic medical condition, oftentimes more than one chronic medical condition. And while patients say, well, if I just, if I have to exercise, how am I going to fit it in? If I have to change my diet, how am I going to do that? Is it going to be expensive? Is it going to be with all of the barriers that they can think of that will prevent them from doing these behavioral changes? There is a mnemonic for this in lifestyle medicine, and it's called SMART. So if you chunk it and make it accessible and easy, it doesn't seem so overwhelming, and it becomes something that is more realistic to achieve. So SMART stands for specific, measurable, achievable, relevant, and time-bound. So each one of these things, since it relates to a behavior, if we can pick something that's specific, if we can figure out a way to measure it, if we can determine that it is achievable and that it's relevant to the condition that we are addressing, and we give ourselves a time window with which to start to apply it, it doesn't seem so abstract. And it can be incredibly powerful to do this in tandem with the medications and the rehab therapies and all the other strategies that we have for managing Parkinson's disease.
And
Dr.
to
Farmer?
build on,
Sorry.
to build on that, I was just going to say it's, you don't have to do this all, like figure out everything all at once. So it's not like when you're looking at the screen, it's not like we have to figure out nutrition and exercise and sleep like all at once. I always say it's like a puzzle, and I love doing puzzles, probably other people do too. And you always find the corners first, right? Or that's how I do them. I always find the outside and the corners first. So find your corner pieces, whether that's exercise or nutrition, get that together, and the other pieces really start to fall into place. If you are focused on exercise and you have goals around exercise, like Dr. Farmer was talking about, you're going to want to get to bed earlier and sleep better and eat better so that you can exercise and you feel better when you're exercising. So these things really kind of start to fall into place once you pick one of them and really focus on that. And the other thing I wanted to mention with regard to what Dr. Farmer was talking about with goals is it's really important to set goals around this, but goals that mean something to you. So for a lot of people saying, I'll walk every day 1 mile. Well, maybe you will, or maybe you won't. And if it's raining, maybe it's easier to kind of forget that. Or if it, but if you have a goal to be able to walk your daughter down the aisle, or to travel with your partner, or to, and walk down cobblestone streets, or whatever it is, but it's setting a goal that means something to you so that when it gets harder, when Parkinson's gets in the way, you can go back to that goal, and that will hopefully help keep you going.
So I did have a question about lifestyle medicine versus integrative medicine. What's the difference between them? And this person also was curious as to whether this kind of care is covered by insurance.
So lifestyle medicine is it's part of the spectrum of different qualities of different types of medicine approaches that are out there. There's functional medicine, there's integrative medicine, there's holistic medicine, naturopathic. So you might have heard all of these in discussions or seen advertisements for different practitioners. And it really, where you fall on that spectrum sort of varies on what the focus is. So in functional medicine, providers may be looking more towards panels of testing that can look at exposures to different environmental risks or toxins or things like that. In naturopathic medicine or homeopathic medicine, they might be focusing more on behavioral strategies as opposed to medications and other types of interventions along that regard, more supplements and things like that. What lifestyle medicine looks at is it looks to be a complement to the other types of strategies that have traditionally been utilized in the practice of Western medicine. So this isn't to take the place of your medications. This isn't to say that you can cure everything by eating a plant-based diet, or that you can sleep, better sleep will magically help all ailments. What it's meant to do is show how these particular pillars can enhance a good strategy for treatment of chronic disease. So it takes some of the other aspects of those different categories of complementary medicines, but is really meant to use it in combination with the tools and strategies that have been traditionally taught in treatment paradigms for the current chronic conditions that patients see. It is an attempt to sort of move the dial and swing the pendulum back to things that we were already doing. We didn't used to be a sedentary. We didn't used to have such busy schedules where we weren't able to be out in nature and do physical labor and things like that. So we lost a lot of the foundations and fundamentals for good, healthy activity. And like I said, this is not rocket science. This is trying to reincorporate what, as a society, we've sort of lacked with the advent of, more technologies and busier schedules and more white collar jobs and that sort of thing.
Well, I like that you mentioned bringing it sort of back to some foundational behaviors that we sort of gotten away from. And I think that speaks to the question somebody had of why is the medical community almost always make everything so confusing and complex. And I think in a lot of ways, maybe it has, but what you're talking about here is actually going back to the basics. And so I think that's an important conversation to have and to kind of delve into. So how do we actually leverage these pillars, as you called it, these behaviors to not only proactively take care of our bodies and our brains, but if we already are dealing with something chronic, you mentioned, I think it was Dr. Dolhun, that in some cases with conditions like diabetes and even cardiovascular disease, that you could actually reverse some of that. So can we delve into a little bit of the nutritional aspect of how it relates to the brain, and how do we maybe get back to some of the basics of that and kind of go through all these different pillars?
Sure, I'm happy to start with nutrition. And I think to get back to the person's question about why does the medical community make everything so confusing, but even more, why is this not really a standard part of our care to begin with? We don't learn this in medical school. We don't learn this in our training. So we don't learn about nutrition. We don't learn about exercise. And so your doctors just simply, I'm making blanket and generalized statements here, but in general, we don't get this sort of training. So unless we're interested in taking the time outside of, already very busy schedules to learn these kinds of things, we just don't have this knowledge. And, before I had this knowledge, I would always say, the tools in my toolkit as your physician are the medicines, are the surgeries, and those still are my tools. But now I have additional tools where I can help with nutrition and help with exercise. I'm still not the be all end all, of course, and I have to rely on and leverage other team members. That's part of that, getting your whole Parkinson's care team in place. So that could be physical therapists who can help with exercise, group exercise classes that can help you with accountability and with specific symptoms of Parkinson's, dietitians who can help with nutrition, et cetera. So again, it's really about, gathering this knowledge. Everybody on this call is seeking out this information and knowledge for themselves. So a lot of times it's you being proactive and you almost bringing this back to your doctors and saying, how can I get the right care team in place? And what can I do to bring this into part of my care? But more and more excitingly, we're seeing more attention to this, more focus on this. And I think most movement disorder doctors at this point are recommending exercise at the very least. So there's good adoption of some of these tools, and we'll see in the coming years more and more adoption. To get to your question specifically on nutrition, what we see in general for most of these chronic diseases, but specifically for Alzheimer's and for Parkinson's, is focusing on what we call a whole food, plant-based diet. So what does that mean? Whole food is looking at foods primarily in the ways that they come from the ground or they come from nature. So as minimally or unprocessed as possible. So that's going to be the things that we see around the outside aisles of the grocery store, the produce, the fruits, the vegetables, whole grains, less things on the inside aisles where they're in packages and boxes and they have lots of ingredients that we don't know what they are, we can't pronounce them. So it's really, the foundation is really this whole food, plant-based meaning, or plant forward, meaning that's the foundation of it. We're looking at plants, plant food sources, produce, fruits and vegetables, as I said, whole grains, beans, legumes, nuts, seeds, olive oil, etc. The two diets that have been most studied for both Parkinson's and for Alzheimer's are the Mediterranean and the Mind diet. And these are both those whole food, plant-based diets. So both of these diets really, again, their foundation is fruits, vegetables, whole grains, etc. They do allow fish, poultry, dairy in moderation, and they ask that you limit sweets, dairy, and red meat. So the thing about these two diets is, as I said, they have been most studied for, I mentioned, sorry, kind of all over the place. Mediterranean, that's Mediterranean. Mind is very similar to Mediterranean. It's a combination of Mediterranean and DASH diet, which was introduced for high blood pressure. And Mind was created specifically to support cognition. So while they're both very much the same, the Mind is a little bit more prescriptive in like what exact foods you should be eating and what kind of quantities and how often. So the Mind will focus more on like leafy green vegetables, blueberries as part of your fruits, etc. The thing I like to stress about these diets is that it's really less about following them to the letter and looking at, how many blueberries am I supposed to be eating, how many times a day, etc. But knowing these concepts and then incorporating them into your daily life, because diet is a way. It's a way of life. It's not just a strict pattern of eating where you're supposed to cut many things out, or foods are good or foods are bad, or you avoid things. It's really supposed to be about most of the time eating well, eating these healthy foods, but still enjoying life. And also being able to continue this diet while tailoring to your lifestyle, your family, your preferences, your culture, etc. So while these diets, as I said, have been most studied for Alzheimer's and Parkinson's, and we have the most data here to show that they could potentially prevent or delay onset of these diseases, they ease symptoms, especially of Parkinson's. They might even slow progression of these diseases. Like most nutrition research, it's hard to do. It's really hard to control what people eat for a long period of time and to know that there's not other factors that aren't contributing to any beneficial effects we're seeing. Like people who eat well are probably more likely to exercise. Is it the exercise or the eating well that we're seeing the benefit from, right? So nutrition is really, really just hard to study in a rigorous, controlled manner. And like much research, it hasn't been widely representative. So we haven't been able to study nutrition in broad populations of people with Parkinson's and with Alzheimer's. So that's why all of this data is really caveated with, this is what we know is best right now, but you also have to incorporate it and tailor it to your personal life situation, symptoms, tastes, etc.
And to piggyback on that, again, this doesn't sound like something that is earth-shattering. Like this is something that everybody knows, but it's hard to do. And this is where that small incremental change can come into play. If you are a soda drinker, maybe don't change anything else about your diet, but cut out the soda or cut down gradually the amount of soda that you drink. Or if you have excessive caffeine intake, same thing. Or if you eat red meat 4 days a week, maybe your goal is simply to cut it down to 2 days a week for a short period and then gradually make it smaller. So it's not something that you have to go and change your entire, way of eating and your entire profile. But if you're curious about it and you're looking to see if there's some small incremental steps that you can do, changing some aspects of your diet is a way to try and incorporate these lifestyle practices. I will say the Mind diet also allows a glass of wine, so there are some benefits. And if you're wondering why these two diets have been studied and why they focus on antioxidants and things like fiber, Americans are the most deficient in fiber. Like out of everything that we have, even people with good diets are deficient in fiber. And if you can increase foods that increase your fiber, not just necessarily taking a fiber supplement, you increase the absorption of the nutrients that you're getting from your food. So you're getting more bang for your buck. You are also helping to like chelate the cholesterol and the bad things out. so that you can, through your digestive tract and your GI tract, excrete them so that they're no longer in your system. So fiber is one of those things where if you are curious about, are you getting enough? Chances are you're probably not, and adjusting some of the foods you eat to increase the fiber. And things like antioxidants, everyone always asks about supplements. So neurodegenerative disease have a lot of pathology that go around oxidative stress and the breakdowns of chemicals in the brain and what it can do to the tissue and the nerves and the neurons and things like that. So having foods that are rich in antioxidant properties are the reasons why these diets may be more helpful for neurodegenerative conditions. So it's not just that they're good for you, but there is rationale and there is metabolism data to suggest why they would be.
And there's also a lot of evidence. You mentioned fiber, and so the fiber, the antioxidants from the fruits and vegetables, not only the antioxidant benefits, but also potentially less inflammation. We see inflammation in the brain with Parkinson's and with Alzheimer's, but a really hot topic, the gut, right? And the gut microbiome, all that bacteria and viruses and fungi that live in our gut. And doctors will say they don't live rent-free, right? They have jobs to do, and they're good for making vitamins, for digesting our food, for supporting our immune system. But good foods feed the good bacteria, and specifically fiber feeds something feeds good bacteria that make something called short chain fatty acids, which actually help keep the lining of the gut intact and tend toward less inflammation. So they're kind of anti-inflammatory. So we're seeing that we know that diet can impact the gut and the gut microbiome. We know that the gut and the brain are connected. And we know that in both Alzheimer's and in Parkinson's, the gut microbiome and the gut change. We don't know exactly why or how, but we know there's a change there. So any positive impact you can make through diet could potentially have an impact on disease and disease experience.
So we've had a few questions coming in regards to what should I avoid? And can you have soda if you use like poppy or, something that doesn't have like aspartame or something like that. So can you speak to maybe some things like that might be more risky or things that people in general should avoid in their lifestyle management?
I can start, and then Dr. Farmer, I'll let you chime in. I always like to think about what can you add versus what you have to take away. So can you add some vegetables to your breakfast? You don't really think about vegetables as a breakfast food so often. Can you add vegetables to your breakfast? Can you add blueberries to your oatmeal in the morning? Can you add, what can you be adding versus focusing on what you have to take away? Now, otherwise, in general, I think there are some, small substitutions and things like you talked about. And it's, there's probably not a whole lot on like what exactly you have to cut out or what you have to avoid, but where based on what you're doing, you might want to make small changes. So like, for example, there's a question on juice. Well, maybe instead of the orange juice, you try to switch to an orange or something like that, right? Because if we're eating the actual orange, we're getting less sugar from the juice, less artificial and processed sugar from the juice. And we're also getting fiber from the orange and other benefits. So thinking about little swaps like that, or, like Dr. Farmer talked about before with, if you're drinking 3 sodas a day, maybe you switch one of those full sugar, high calorie sodas for a sparkling water with some juice in it or something like that. So again, it's about finding these kind of simple swaps, and it's hard to, like I said, categorize foods as completely good or completely bad, or talk about foods you should completely avoid, but thinking about, what are the small swaps that might be beneficial for you and might get the ball rolling for you in making bigger and more sustained changes.
And to piggyback on that, I absolutely agree. It's easier to add good than take out bad, so that it doesn't feel so restrictive or, persecutory. But there are some things that you should just try not to eat. And those things would be processed foods. So if you are somebody that grabs a muffin top out of the cabinet in the morning because it's easy and it's portable and it's raring to go, and all the reasons why every single one of us do it, that is not healthy, sugary, white flour type of empty calories, and with little to no nutritional value. So see if you can adjust that to something else that's portable. Maybe you can make a whole grain thing yourself. Maybe you can make little muffins that you stick in the fridge that you grab instead. You've made it. Most of Americans get their poor food habits from the processed food that they eat and going out to eat. 70% of all of our salt comes from, pre-made meals and restaurant meals. So if we're doing it ourselves at home, you can try to mimic what is not good by using better ingredients and making it better for you. And the other one is red meats. Unfortunately, for all the iron and benefit that red meat can give, there are other avenues with which to get that. The fat content and the type of fat that it is and the stress that it puts on the digestive system. Red meats are, if you had to make one choice, that would be the thing to cut back on or avoid.
So I guess my segue to the next thing is related to Catherine posting about studying walking, reversing hippocampal age-related atrophy. And I wanted to ask if you could delve into a little bit about the role of exercise in protecting the brain, or the impact it has on the brain.
I can start. Yeah, exercise, it has a myriad of benefits, not just on the brain, but of course on our whole body, on our heart health, on decreasing heart disease risk and decreasing stroke. As far as the brain and mental health, I should say as well. As far as the brain is concerned, what we see the impacts are on a cellular level. Exercise helps us make more brain growth factors that are like brain fertilizer to help grow new cells. You can actually grow new brain cells, and you can actually change your brain no matter how old you are. It's a myth that we've busted a long time ago. So growth fertilizer to help you build new cells, stronger connection between those cells, better blood flow to the brain, better, flow through those blood vessels to support all of those cells, less inflammation. For people with Parkinson's, helps with dopamine signaling, so actually helps your medication work better. So that's kind of back to what we talked about at the beginning. It's not exercise or medication, it's exercise and medication because they work hand in hand. Exercise helps your medication work better, and medication for a lot of people helps you be able to exercise better because it gives you more mobility and decreases your symptoms. When it comes to recommendations for exercise, the kind of basic guidelines are to do aerobic activity. So that's that cardio, gets your heart pumping, all the things we kind of think about when we think about exercise: jogging, walking, running, cycling, swimming, etc. 150 minutes per week. So that's like 5 30-minute sessions of moderate to vigorous intensity. So that's based on your maximum heart rate, and there are resources that go into more detail on exactly where you want to be and how to get there. But that's the kind of basic guideline. You want to be doing that level of physical activity, of exercise every week. Now, for people with Parkinson's, and us as we all get older, there are other components of exercise you want to think about. That's strengthening exercises. So it can be weights, but it can also be just body weight. So making sure that you're doing those strengthening exercises at least twice a week to build stronger muscles, bones. Bone loss is a thing, of course, as we get older, as we have Parkinson's, we're at risk of falls, etc. So making sure that we're complementing that aerobic exercise with our strength exercise. And then that we're also adding in components of flexibility, like stretching, and balance and agility. Now that can seem like a lot, and like, exercise is now my full-time job because I have to figure out how to get all of this in. But a couple of things. There are some exercises that combine a lot of these different elements. So things like boxing or dancing that kind of kill two birds with one stone, and you get multiple of these components at once. There are also ways you can break exercise down. So when we talk about a 30-minute session 5 times a week, if you can't find 30 minutes, or if that just doesn't work for you, 3-10-minute sessions can be just as good. So you can break it down into increments of time throughout the day that work well for you. And there are a lot of ways too. Some people talk about, trouble with motivation or trouble with accountability. There are ways to build that into your exercise as well. So a lot of group exercise classes for Parkinson's, whether it's dance or boxing or cycling, even online available, where you can join something like this, and you're just at your home, but you can see everybody else. And if you don't show up to class, people are going to wonder where you were or ask how things are going. So there's that kind of accountability. You can have a partner. You get the social aspect of it, which is really important for brain health and important for having a support system in Parkinson's. So there are a lot of ways to optimize and maximize exercise in your life, no matter what your fitness level, what your age, what your Parkinson's is like. And I will say, we at the Michael J. Fox Foundation created a really comprehensive guide on exercise that was just published earlier this year. And I think we have the link for that, but we'll share it later if we don't have it actively available right now. But it goes into much more detail on all of this. What kinds of exercise should you be thinking about? What falls in what category? What about when I get tired? What about when I have dyskinesia? What about, how should I take my medicine around exercise? So it really delves into all these different components of exercise when you have Parkinson's.
And I often get the question, but I hear all that, but really, what exercise should I be doing? And to start out, I tell patients whatever they like, because I want them to do something consistently. That 30 minutes, 5 days a week, 150 minutes a week is a great goal. That's also the starting goal. So if I can get you to, work your way up to that and then go beyond, that is only going to be beneficial to you. And it also matters what your level of activity is at the starting point. Not everybody's coming to it from different things. So you're not going to take a total couch potato and, expect you to be able to do 30 minutes of intense activity right off the bat. But if you're specific in what your goal is, I'd like to walk to my mailbox, you get to walk to your mailbox. And then, after you feel that you're comfortable with that, you can, extend it to the end of the street. And then once you are walking, then your next thing might be, well, I'll pick up the pace a little bit, because a lollygag walk is different than something that's a little bit brisker and more challenging. But the point is not so much the intensity level from when you start, it's just the act of getting up to do it and committing to something and then slowly working towards it. It is our goal when we're talking to patients about lifestyle medicine strategies and when we're using these prescriptive ideas is not to discourage you. So it's not that we want to put so much on your plate that you feel overwhelmed. It's to give you the tools to slowly incorporate them into your activities that you look back on it and say, oh my goodness, like 6 months ago, and again, 6 months is a long time. 6 months ago, I wasn't able to do X, Y, and Z, and now I am. Like, you've done it. That level of change over, that amount of time is the sort of thing that realistically you're looking for. You're not looking for it to change overnight.
And just to underscore that point about not trying to discourage, I think I know what I hear from a lot of people is, gosh, this feels like so much. And I know I'm supposed to exercise, but then I don't. And then I feel even more guilty. And then it's like I throw my hands up and say, forget it. Because if I can't do the 150 minutes or if I miss a week, then, I'm not doing it well. So we want to really address that and remove that guilt as much as possible. Anything is good. Anything is better than nothing. And so anything you can do, it's never too little, it's never too late. And, whatever you do is going to be beneficial. And then the other thing I wanted to say just before we leave this slide is the title on here is physical activity. Physical activity is a general umbrella term for any kind of movement. So that's movement that you're doing as you're walking up and down the stairs at your house, as you're doing your household chores, you're running errands, you're doing your hobbies. It's any kind of movement. Exercise falls within that category of physical activity, but it's more of a structured, repetitive, goal-directed exercise to maintain or improve your fitness. So there is a little bit of a difference here where, yes, that activity of vacuuming your house and folding your laundry and walking up and down the stairs, that is good. But as much as we can get you to be doing that structured exercise, 150 minutes a week, and the strengthening exercises, et cetera, even more beneficial. But it is important to have both of them. So, you can exercise for your 30 minutes a day, but then you don't want to just go to what Dr. Farmer said, go lay on the couch all the rest of the day. That's not good either. You don't cancel out all those negative benefits of sitting around all day just by doing 30 minutes of exercise. I learned that the hard way. So we have to be getting up and moving throughout the day. That's good for us in general. It's also good for maintaining a good sleep schedule at night. So as much as we can be, setting an alarm once an hour to get up from our desk and walk around, or getting up when we see the commercials come on, or whatever it is, just so that we're building in that regular movement throughout the day. That's just as important as that structured exercise.
I've actually heard them called exercise snacks before. Yeah. So that is fantastic. So one of the other things that I know you mentioned it earlier, related to this entire concept of lifestyle medicine, is related to sleep. And I know that just in the US in general, I think we tend to be a little bit sleep deprived. So can you talk about the impact of sleep on brain health and how to achieve it if people are struggling?
Sure.
Yeah. Oh, you go ahead.
Oh, I was going to say, everybody feels better when they get a better night's sleep. And you have many things working against you with Parkinson's because there is an odd relationship with dopamine or the loss of dopamine in sleep. There is an increase in anxiety, which can impact sleep, and sleep architecture just diminishes as we age anyways. So there are many reasons why you may not be having a good night's sleep. And some of the things that we talk about when we talk about sleep is our goal is not a perfect this says 7 to 9 hours of uninterrupted sleep. Like, our goal is not to have that expectation because that's likely going to be unrealistic. So our goal is to get good sleep in the style that works for the patient that we're having this conversation with. We can address that through physical activity. If you, again, notice if exercising in the morning is helpful and it puts you into a good place for sleep at night. But if you notice if exercising at night kind of is a bit stimulating, then we talk about adjusting where that is. What you're eating before you go to bed, how close you're eating to before you're going to sleep, how much you're drinking before you go to bed. Behavioral strategies to try and adjust things that may be setting you up for frequent wake-ups in the middle of the night. And then it is, how is your dopamine attributing to your sleep patterns? Are you someone where dopamine is helpful? So if you take your medication right at bedtime, is that going to give you a little bit of easier window of falling asleep but not staying asleep? So you might need to replenish that overnight. Or does dopamine rev you up? So that's not something that you want to have before bed. So there's a lot that can go into setting yourself up for a good night's sleep just by the strategies that you apply in the window right before you're going to bed. And again, routine is so key in so many things with Parkinson's disease. So having a good routine, not watching TV up till the time you go to bed, not being on your screen while you're in bed, things like that can be helpful. But sometimes you do need pharmacologic help when it comes to going to sleep. And there are different things in Parkinson's that can be utilized, whether it's Parkinson's meds or things outside of dopamine altogether.
For those who may not have a diagnosis yet, Can you talk a little bit about the benefit of sleep? If they're concerned and we talk about the impact of sleep on the brain, is there can you address that from those who may not already be diagnosed or just wanting to maintain their brain health? Like, is there anything that they could be doing if they're coping with issues with insomnia, or what sleep hygiene might mean for them?
Yeah, reinforcing everything Dr. Farmer said. So we know sleep is good for us. We don't know exactly why it's so good for our brains. There's some thought that maybe we're clearing some toxins and kind of flushing things out as we sleep. There's also a lot of knowledge that sleep is when we kind of consolidate our memories. And so when we kind of process everything from our day and we turn those things that we learned into kind of longer term memories. And, as Dr. Farmer said, like we all just know when we sleep well, we function much better and we feel much better versus when we don't have a good night's sleep, which we've all experienced. It's harder to process things. You might be a little bit slower. You might be a little bit crankier. You might be, it might just be kind of harder to get through the day. So sleep really is the foundation. I saw a comment come through that somebody said, I didn't really realize that it might have an impact on my hunger, what I eat. Well, that's the other thing. These are the puzzle pieces we talked about earlier, that when you're sleeping well, you might have more energy to exercise. Your mood might be a little bit better. You might make healthier food choices. Like think about the last time you had a good night's sleep. Were you like much more ready to get up and go for a walk in the morning versus just stay on the couch and, eat a donut or whatever, right? So it's these healthy lifestyle factors reinforce each other. So I would just say, everything Dr. Farmer said as far as sleep hygiene, we have a saying that like a good night's sleep starts with you when you wake up in the morning. So it really is about everything you're doing all through your day that sets you up. It's not just that last hour before you go to bed. It's everything that you're doing through the day. It's how much you're moving, if you're exercising, what you're eating, when you're eating it, et cetera. And one that Dr. Farmer didn't talk about, and one that I think we don't pay as much attention to, is natural light exposure. So how are we mimicking what the sun is doing, or just kind of responding to what the sun is doing and getting our body clocks set on that. So when we get up in the morning, that would be the time, if that's the time we want to be up and we want to wake up, get exposure to light, open the windows, get outside for a walk, kind of amp yourself, prime yourself for having that natural light exposure, sit near a window during the day. And then as the sun sets, dim down the lights in your house, turn off the screens, or get, those blue light blockers. The hour or so before bed, unplug. So think about how you can, in your day-to-day, kind of mimic that natural light exposure of the sun as well.
And I just put in, because you reminded me of it, there is a website, lightforpd.com. It's not natural light. It happens to be blue light, but it's out of the University of Rochester. And it is a completely virtual study where they will send you a blue light machine. You sit in front of it for an hour a day, and it's meant to look at the non-motor symptoms in Parkinson's disease. So things like sleep and depression and anxiety and pain. And then motor is secondary, which is sort of interesting because usually it's the other way around in our studies. But it is open to your own recruitment, if you will. So you can go to the website, fill out some information, and then someone from the study team would get back to you if you meet the pre-screening qualifications.
Can you speak just briefly, because I know there's some other things that you still want to cover, but how REM sleep behavior disorder can really impact, or how it impacts quality of sleep?
Sure. So that is one of those prodrome questions. It's not necessarily specific for Parkinson's. It can be seen in a number of neurodegenerative conditions, but it is something that can predate a diagnosis by decades. And what it is very active movement or vocalizations during your dream sleep. And the irony being that Parkinson's patients have such difficulty moving while awake. Everyone's supposed to be paralyzed while they sleep so they don't act out their dreams, but Parkinson's patients are not. So they move quite freely during their dream sleep. And it's often a very emotionally charged dream. Someone's being chased, someone's trying to protect, they're in a fight, whatever it might be. Bed partners are getting kicked and punched and yelled at. Some people fall out of bed. This is, again, something that can raise a red flag that someone might go on to develop a neurodegenerative condition. Not everybody that has REM behavioral sleep disorder does, but it is something that we know is an associated risk factor. The question becomes, what do we do if someone has REM behavioral sleep disorder, but no signs or symptoms of other neurodegenerative conditions? There's no medicine that we have that can change the, course of the disease at this moment in time. But there might be lifestyle modifications that you can do if you fall into this category that may have benefit in the future if you are one to go on to develop a neurodegenerative condition.
So in the next 10 minutes, I want to cover, have you guys cover another pillar that I remember seeing, and I know is something that everybody deals with, and that's stress and stress's impact on our health and our brain health.
Yeah, stress is kind of like sleep. It's something we historically have not paid enough attention to, or just thought, it's a natural fact of life that you don't get enough sleep or that you just have stress. And that's true. We all have stress. It is a normal reaction to difficult situations. It's normal to have this worry and this tension. Shows up in different ways for different people, right? And it comes from different areas for different people. But the fact of the matter is stress does play a role in all of those chronic conditions we've been talking about in and outside of the brain, whether it's kind of contributing to bringing them on or exacerbating them. In Parkinson's, we see that stress can temporarily worsen symptoms, things like tremor, sleep problems, which we just talked about, mood changes, cognition even. And it's thought that from some of the early studies that stress can actually contribute to progression of disease, so can actually increase progression of disease. Now, it's important to caveat there are different types of stress. So there's acute stress, which is something that helps protect us, right? So if I'm stressed out because I have a test tomorrow and I've got a cram and I'm stressed, I'm going to really focus and I'm going to get through that. Or if I'm driving and somebody jumps out in front of my car or something, I hyper focus, my blood pressure increases, my heart rate increases so that I can address what's right in front of me. Again, this is a protective thing. The problem is that we've evolved now where we don't need as much of that like sudden spike in stress. But we've got this kind of chronic low underlying level of stress that's always there. And that chronic stress is thought to increase stress hormones that maybe contribute to increasing inflammation in our body and maybe even decreasing some of those brain fertilizer factors I talked about before. So when we think about stress, what's really important is, as I mentioned, it shows up in different ways for different people. So we've got to learn what does our stress look like? My stress is going to look different than yours. So what does my stress look like and where does it come from? And then from there, experiment with strategies to decrease stress. So that can be physical exercise we talked about. That can be really beneficial for a lot of people. Mindfulness and meditation. Some people kind of tune out as soon as they hear the word meditation, but mindfulness is really just being in the present moment without judgment. So I'm here, I'm speaking, I'm not judging myself for what I do or don't say or how I look on camera or whatever. I'm just here and this is just what it is, so it's kind of that, but with regard to your stress. So right now, life is challenging. Right now, I have a new diagnosis of Parkinson's. Right now, my symptoms are changing. And how can I be in this moment? So there's mindfulness, and there are many different ways to practice mindfulness. That can be meditation. It can also be journaling. It can be keeping a gratitude list. It can be praying. It can be creative pursuits, whether that's coloring books or flower organizing or woodworking or whatever it is. So there are so many different ways to manage stress, that are mindfulness or not mindfulness. There's also, of course, mental health counseling and therapy. There are medications to help with anxiety and depression, because those are linked to stress as well. There's building your support system. We're going to talk about social connections in a second. That helps you raise your resilience to stress. So the bottom line is really, we all have it. It can play a role in Parkinson's and our experience of Parkinson's. So we have to identify our stressors and then find ways to cope with them.
And I think that the identification and acknowledgement is so key, because very often we're dealing with a patient population that was, you know, raised and grown up in a time where you just grinned and bear it. You didn't talk about the stressors of your life and how it might impact. And it's something that, speaking to your physician, speaking to, if you have a therapist, just acknowledging the fact that it's okay to see the impact that this has on the motor and non-motor symptoms of Parkinson's disease. It doesn't diminish them. It doesn't mean that because of stress, it's all in your head or anything like that. It is as much a, it is as much, I don't want to say a risk factor, but I can't think of another term right now. It is as much of a risk factor as anything else. And if you acknowledge that you need to adjust your behavior, your treatment strategy, your medication, whatever it might be, to deal with it, because nothing happens in isolation, then it can really have a huge impact on the overall quality of your symptom management. So I spend a lot of time just reinforcing the idea of, let's talk about it. It doesn't necessarily need to seem like a big deal, but it may be a big deal in the grand scheme of things.
So I think tied to reducing stress is what you mentioned is coming up next, is real quick, is the social connection, and having those social connections really can help with stress management. Can you talk about the importance of it in regards to not just stress, but just in general, how it helps with us in our health?
So I think the pandemic highlighted just how important the social connection is. And there's been a lot of studies that have come out of that, especially in the Parkinson's population, of the increase in whether it was pathologic progression versus symptomatic progression of patients who were isolated during the pandemic, and how it impacted their cognition, how it impacted their motor symptoms. So this social connection is so important for the normalization of everything. It takes away some of the anxiety when you see other people dealing with the same thing that you're dealing with, and seeing that it's able to be managed. There are different ways to go about addressing it, that you're not the only person in the world that is experiencing this. And so it doesn't feel as isolating or as overwhelming. So there is a huge component to socialization of, you know, whether it's face-to-face in person, whether it's online, whether it's through an advocacy community, just so that you can have that lifeline of connection with other people.
Yeah, it makes you feel less alone, right? And we can feel very alone, especially with Parkinson's. People, you know, loneliness has been tied to an increased risk of Parkinson's, and vice versa. People with Parkinson's can certainly feel very lonely, whether it's dealing with a new diagnosis, dealing with a spouse's new diagnosis that has not been shared yet, symptoms evolving and feeling stigma, or feeling like you want to withdraw because you don't want to be out in public, etc. So social connections are really the antidote to that loneliness. And it's important to have not just, it's important to stress the quality over the quantity. So we're looking for meaningful, positive connections. And you can still feel loneliness is really the perception of not feeling, you know, for lack of a better term, connected to other people. You can feel lonely even if you're married, right? So there is a lot to consider when you think about connections. There's not just that spousal or that close, intimate relationships. There's our friendships. There's the community that Dr. Farmer talked about. And it's really important to address all of those and to think about all of those. And again, emphasizing the quality over the quantity.
Well, I want to thank you. You guys have touched on all of the key things. I think that I know there was maybe one section that we didn't get to in our hour, but I think you did a great overview of just the general idea of what lifestyle medicine is and how we can implement it into our practice of life, taking care of our health, whether that's our brain health before we've been diagnosed with something and kind of mitigating some of that, or, if we're already diagnosed with something, how to optimize the way we feel and maybe slow things down with some of these lifestyle choices. So thank you for taking the time, to the two of you, of reviewing this so well, answering some of these questions. And I know that our community is very appreciative of this. Again, I will just remind everyone that this will be recorded. It will be up on our Proactive Brain Health Alliance website. I think they're also sharing it on PMD Alliance website. I want to thank all of you for joining us. And again, please feel free to check out that website, and please save your chat, because I know that there's been some resources that's been dropped in the links. I know Dr. Dolhun's mentioned the guide that they recently published this year. There's a link to that in there, the link to the Proactive Brain Health Alliance website. We'll have resources on there. And again, if you are somebody who's prodromal, you haven't been diagnosed with anything yet, but you do have some symptoms, or you're at risk, or you're concerned, we do have our next program coming up on October 29th that will be giving you some space to ask some questions around that. And thanks to C&D Life Sciences for supporting us in this endeavor and partnering with us. Dr. Dolhun and Dr. Farmer, thank you so much for coming and joining us and giving us such great information today.
Thank you for having us. It's always a pleasure.
Yes, thank
I know
you.
everyone waves across the miles and to thank you. So everyone, I hope you have a wonderful rest of your day.
Bye-bye.